Hello. These are the postoperative instructions after an all-on-4 procedure or full arch dental implants. First of all, congratulations on your new smile. It's normal to have a lot of questions after the all-on-4 procedure, and I would encourage you to watch this video more than once so that you don't miss anything that's in here. The first thing that we want to talk about is hygiene. Your new teeth that are screwed in have to be cleaned differently than your natural teeth would have been cleaned. You can use a toothbrush to clean the teeth. However, we don't want you to use any toothpaste, as that can scratch your new teeth and that will allow stain to be incorporated into the new teeth. So you can use a toothbrush, but please do not use any toothpaste. In order to clean, we want you to use a water pick, and we will have demonstrated for you how to use a water pick at the junction of where the teeth are and your gums meet. I request that you don't use the water pick for the first 3 days. Beginning on day 4, you can use the water pick on its lowest setting. Most water picks will let you go from a low setting to a high setting. Use the water pick on its lowest setting for the first week of using it, and then you can gradually turn it up. The purpose of this is that your incisions are sutured together, and we don't want to use too much pressure with the water pick and risk opening up the incisions. You also can use a saltwater mouth rinse if you want, which is take a glass of room temperature water and put a dash of salt in it, and you can gently gargle and swish with that. Or you may have been prescribed a prescription mouth rinse. The next issue with the all-on-4 procedure is diet. It's very important while the teeth are healing, or while the implants are healing, that you are on a soft diet, which I know this has been explained to you. The important thing, and a good rule of thumb, is if you can take a plastic fork and push it to the bottom of the plate, then you can eat. That's something that you can eat without risk of damaging the teeth or the implants. We want you to stay away from things that you bite or tear into. Stay away from salads, stay away from sandwiches, no pizza, but roasted meats that just fall apart, shredded chicken, well-cooked vegetables, mashed potatoes, scrambled eggs, smoothies, all of these things are obviously fine. We have some patients who will see for post-op and they've been on essentially just eating soup or a liquid diet, and that's not what we want. Your diet does not have to be that restrictive. You just need to be on a soft diet and be careful. It's also really important that you get enough calories after a big procedure like this. So we really encourage you to watch your caloric intake and make sure that you're getting, for most patients, at least 2,000 calories a day and drinking plenty of water. We have repeatedly seen that patients who do not get enough to eat after surgery will have delayed healing, more swelling, and just have a rougher postoperative course. You will maintain the soft diet until you're released by your surgeon, who tells you that the implants have integrated and you're now okay to begin transitioning back to a regular diet. It's normal to feel overwhelmed by the changes that take place after an all-on-4 procedure. The teeth will feel different than your natural teeth. You clean them differently. There will often be differences in your speech. You can sometimes bite your cheeks. There can be whistling noises. We hear a lot of different things, and I would encourage you to hang in there. We find that during the first 6 weeks, almost all of these symptoms will go away. All the speech changes, all the swelling. We need to get through the initial healing, and your body needs to adapt to the new teeth. And so anything that seems stressful right now, almost all of those things will disappear over the next 6 weeks. So these were the postoperative instructions for the all-on-4 procedure. Please either call the office or our after-hours number if you have any further questions.